In Nigeria today, a silent threat is stealing our brothers, husbands, fathers far too early. We are seeing a worrying rise in cases of heart failure, especially among men between the ages of 35 and 45. This is the prime of their lives, men building careers, raising families, contributing to our communities. Yet many are falling victim to a condition that is often preventable and manageable if caught early. The problem is serious because many do not recognize the danger until it is too late. The hustle of daily life makes it easy to ignore the quiet whispers of our bodies, dismissing symptoms as stress or fatigue. This is a wake-up call. Your health is your greatest wealth. Heart failure is not just for the elderly or elsewhere, it is right here on our doorstep. It is a leading cause of hospital admissions and death for Nigerian men in their most productive years. When a man in his prime is struck down, the ripple effects are immense. Families, children, and communities suffer. We must confront this issue directly and arm ourselves with knowledge. The expectation to be strong and stoic often works against men. Delaying care until an emergency is dangerous. Hypertension can silently damage the heart for years. Seeking medical advice is wisdom and responsibility. Your life is too precious to gamble with. We will explain heart failure, its causes, warning signs, diagnosis, and treatment in clear, simple terms. Heart failure does not mean the heart has stopped, that is cardiac arrest. Heart failure, sometimes called congestive heart failure, is a chronic condition. The heart becomes too weak or too stiff to pump blood effectively around the body. Think of your heart as the engine. If damaged, it cannot power the body properly. When weakened, it fails to supply oxygen-rich blood to organs, causing widespread problems and progressing over time. The leading cause in Nigeria is uncontrolled high blood pressure, hypertension. For years, it silently damages arteries and strains the heart, thickening and weakening the muscle. African men are prone to earlier, more severe hypertension, a major risk. Other causes: previous heart attacks, diseases of the heart valves, infections including rheumatic heart disease from untreated strep throat in childhood, and viral myocarditis that weakens the heart. Excessive alcohol is directly toxic, causing alcoholic cardiomyopathy, an enlarged, weak heart. Diabetes, obesity, and family history also contribute. Risks often combine into a perfect storm. Recognizing these risks is the first step toward prevention and control. Let us now learn the warning signs you must never ignore. Early symptom: shortness of breath, during activity, at rest, or when lying flat. Needing 2 or 3 pillows to breathe comfortably at night is a red flag. A weak pump causes fluid to back up into the lungs. Persistent fatigue and weakness that limits daily life is not normal. Swelling in legs, ankles, feet. If pressing leaves an indentation, pay attention. Severe cases include belly swelling, bloating, and reduced appetite. Rapid or irregular heartbeat, fluttering or pounding, is common as the heart compensates. A persistent cough or wheeze, sometimes with white or pink-tinged phlegm, can signal lung fluid. Some experience confusion, dizziness, or foggy thinking from reduced brain oxygen. If you notice these signs, especially more than one, do not be brave and ignore it. See a doctor immediately. If you have warning signs, prompt medical attention is the most important step. Do not delay. Doctors start with your history and symptoms, then a physical exam. They will listen to your heart and lungs, check your blood pressure, and look for swelling. A key test is an echocardiogram, an ultrasound showing chambers, valves, and ejection fraction. An electrocardiogram checks electrical activity. A chest X-ray looks for an enlarged heart or lung fluid. Blood tests detect markers of heart strain. The good news: heart failure is treatable. Treatment combines medications and lifestyle change. ACE inhibitors or ARBs, beta blockers, diuretics. Take your medicines exactly as prescribed every day. Nigeria has excellent cardiology centers. Lagos University Teaching Hospital, Idi Araba. Reddington Hospital, Victoria Island, Eco Hospital, Ikeja. Abuja National Hospital, Cedar Crest Hospitals, University College Hospital, Ibadan, University of Nigeria Teaching Hospital, Enugu. Go to the nearest qualified facility. Lifestyle matters. Reduce salt, avoid processed and fast foods, eat fruits, vegetables, whole grains, fish, and beans. Aim for 150 minutes weekly. Walking, jogging, swimming, dancing. Ask your doctor what is safe for you. Monitor blood pressure and blood sugar. Take meds without fail. Stop smoking and limit alcohol. Schedule a checkup, even if you feel fine. Know your numbers. Encourage your friends, brothers, and colleagues. Change silence to action. Taking care of your heart is the greatest gift to yourself and your loved ones. Please like, share, and subscribe for more health videos. your heart will thank you.